Santa Clara County's remarkably low COVID-19 numbers. Despite numerous seeming missteps in the response to the coronavirus COVID-19 pandemic and close ties to China, Santa Clara County in California reports extremely low numbers of cases and especially deaths so far. So this is the Santa Clara County COVID-19 cases dashboard, last updated yesterday, April 22nd, 2020. And it shows only 1,962 cases and 94 total deaths in Santa Clara County, which has a population of almost 2 million people and has very close ties to China, probably the closest ties to China of any county in the United States. This seems remarkable. There was a seeming Chinese cover-up of some sort in Wuhan in December and early January of 2019. People were muzzled, threatened, information clearly suppressed. Therefore, China would seem to have taken very limited steps, not been on top of the situation for several weeks. They didn't stop people flying out of Wuhan or flying to the United States. There was widespread opposition to the travel ban from China. It was opposed by the World Health Organization, and it was opposed by many public health experts. In fact, 430,000 people have traveled from China to the U.S. since the coronavirus surfaced, and according to the New York Times, approximately 40,000 Americans and other authorized travelers have made this trip. The United States badly bungled the coronavirus testing. The World Health Organization recommended a seemingly working test from Germany that is in use in other countries, like Germany and South Korea, supposedly. The U.S. turned it down, said we'd invent our own. That took a couple weeks. They sent out the test, and it had some sort of problem. A faulty reagent is typically blamed. As a result, the testing was delayed by several weeks, and even now we have very limited testing of people. So our ability to track the disease was very limited, and in fact the CDC, I believe, put out guidelines not to test a lot of people, that focus very much only on people who came from China, who seem to be sick, that sort of thing. There are many asymptomatic cases of the disease. This was reported as early as January in China by researchers. This is not unusual. In most disease outbreaks, even very deadly ones, there are many people who are exposed who get sick who never exhibit symptoms or have very mild symptoms. They experience a flu, sniffles, things like that. Even in the Black Death in Europe in the 14th century, which killed a huge number of people, probably at least 10% of the European population, maybe even as much as half, nonetheless, there were many people who did not get sick, who did not exhibit any problems whatsoever, and survived. They almost certainly were exposed, almost certainly got infected, but their immune systems were able to fight off the disease. And this is seen time and time again in many, many outbreaks. It's not unusual, and it should have been expected, or at least considered the normal, likely situation. There is the issue of aerosol transmission. And remarkably, it appears still to be the case that it's not clear how substantial aerosol transmission is in diseases that have been studied for a long time, like the influenza viruses. So this is a review of aerosol transmission of the influenza A virus from 2006. It was updated in 2009 with pretty similar conclusions. And this is actually apparently a controversial topic. So let me read the abstract from this author. In theory, influenza viruses can be transmitted through aerosols, large droplets, or direct contact with secretions or fomites. These three modes are not mutually exclusive. Published findings that support the occurrence of aerosol transmission were reviewed to assess the importance of this mode of transmission. Published evidence indicates that aerosol transmission of influenza can be an important mode of transmission, which has obvious implications for pandemic influenza planning, and in particular for recommendations about the use of N95 respirators as part of personal protective equipment. So this is a section that I think gives a little more detail about what is meant by this. By definition, aerosols are suspensions in air or in a gas of solid or liquid particles small enough that they remain airborne for prolonged periods because of their low settling velocity. For spherical particles of unit density, so that's like water or saliva, settling times for a 3-meter fall. 3 meters is a little over 9 feet, so it's above mouth level. So, a typical person might be 5 or 6 feet tall, so it's not really quite what you would see with a human being. Settling times for specific diameters are 10 seconds for 100 meters, 4 minutes for for 100 microns. A micron is a very small size, and viruses are typically smaller than a micron. So viruses are typically 25 nanometers to 400 nanometers in size, and a micron is 1,000 nanometers. So all of the droplets he's talking about are substantially larger than a virus and can contain one. So 10 seconds for 100 microns, 4 minutes for 20 microns, 17 minutes for 10 microns, and 62 minutes for 5 microns. Particles with a diameter less than 3 microns essentially do not settle. Settling times can be further affected by air turbulence. So this means just by breathing, just by talking, just by walking around, we could spread particles that remain in the air indefinitely if they're smaller than 3 microns. So if there's a lot of aerosol transmission, or even maybe a small amount, maybe 10% of it, sort of quote 10% of it, is through aerosol transmission, most of the sheltering in place measures, most masks, most things that are being done will not be effective. It will spread. Aerosol transmission is almost unstoppable unless you're wearing a spacesuit or in a hermetically sealed room, literally with airlocks. So all of these factors make it likely that there would be a lot of transmission of the disease in December, January, February, and early March before the shelter in place was declared in Santa Clara. So Santa Clara County has just under 1.9 million people. This is the U.S. Census, by the way. These are official government figures for what they're worth. 1,927,852 people. Santa Clara County is home to Apple, Google. Much of the Silicon Valley is Santa Clara County. Santa Clara County is 38.3% what the government calls Asian. Now, Asian has a very fuzzy definition today. There was a time back in like the 80s when it basically meant Oriental. It basically meant people from China, Vietnam, Japan, people with epicanthic folds and a sort of olive to white complexion and high cheekbones and round faces and all of that. In fact, it's been sort of expanded to include, so these numbers may include people from India, Pakistan, South Asia is often the way those people are described now, and even people from the Middle East, like Iran, for example. But in fact, just walking around and living in Santa Clara, it's quite obvious that a very high percentage of the population is from China or Chinese immigrants, children of Chinese immigrants. Many people are Chinese nationals on various visas, like the H-1B visa. So I know many people like that. I have relatives who are Chinese or Chinese extraction. I mean, the reality is that a high percentage of the workforce at the companies here, like Apple, I work for Apple, are actually Chinese nationals. They're actually here on visas, or they're immigrants, or things like that. It's not unusual, and it's not a few percent. It's more like, at least in the group that I worked in, I would estimate around 30% of the people I interacted with, engineers and technical workers usually, are from China or immigrants from China and from mainland China. Apple in particular has nearly all its manufacturing operations in China. It has about 1 million contract employees in China through Foxconn and other companies. And almost everything, the manufacturing, the making of the prototypes of products, is all taking place in China. So there's people flying back and forth between Apple, which is in Cupertino, which is in Santa Clara County. They fly back probably every day, many times, to pick up these prototypes, to check on the factories. All kinds of stuff is going on. So it's very close contact, not just in terms of the background of people coming here, but it's just daily contact. A very high percentage of the 430,000 trips from China reported by the New York Times are probably to and from Santa Clara County. In fact, the Santa Clara County health authorities have now reported several deaths, which are now the earliest known deaths where the autopsies produced positive tests for the coronavirus, COVID-19 coronavirus. So the earliest now is a 57-year-old woman who died on February 6th. That's before the first known case in Washington State, a 69-year-old man who died on February 17th, and a 70-year-old man who died on March 6th. The health department also says they don't believe that any of these people contracted the virus from traveling, and this most likely was a case of community spread. Asymptomatic carriers, aerosol transmission, this sort of stuff. It was going on, at least if these reports are correct. Now, we don't know all the details. Now, this is it's a preprint, it's preliminary, it hasn't gone through peer review, it's been bitterly attacked, no surprise. It's from researchers at Stanford and other institutions. It has this dry title, COVID-19 Antibody Seroprevalence in Santa Clara County, California. That's a fancy word for saying that they do so-called antibody tests to detect previous infection with the coronavirus. So assuming that the antibody tests are okay, they recruited 3,330 volunteers sort of randomly from Santa Clara. It's not truly random, by the way, but from Santa Clara County using Facebook ads. And they tested those people for the coronavirus, and they probably found about 45 from reading the paper. So they say here, for example, that the unadjusted prevalence of antibodies to SARS-CoV-2 in Santa Clara County was 1.5%. And the population, so they wait for things like whether you're Asian or young or old or rich or poor to get this 2.81%. But remember, 1.5% of 3,330 is about 45 people. So that's not a huge sample of actual positives. I mean, it's a larger sample. These prevalence estimates represent a range between 48,000 and 81,000 people infected in Santa Clara County by early April, 50 to 85-fold more than the number of confirmed cases. Now, with all the things I've discussed, this is not at all surprising given the close connection between Santa Clara County and China, asymptomatic carriers, aerosol transmission, the testing screw up, the cover up in China. All these different factors mean that it's very likely that the disease has spread way beyond the reported numbers in Santa Clara County. It's not unlikely that this is true. On the other hand, it's been bitterly contested. One of the reasons it's been bitterly contested is that it implies the infection fatality rate of the disease is much lower than the 1% number that's often been thrown around, that it might be 0.1 to 0.2%. So why are there so few cases, and especially so few deaths, reported in Santa Clara County, given it's a large county with very close ties to China, to U.S. manufacturing, almost certainly in Wuhan, which had a lot of U.S. manufacturer contractors in it, according to a number of reports anyway. So why are there so few deaths attributed to COVID-19? Why is it only 94 at this point? One possibility is that despite all the screw-ups, despite asymptomatic carriers, despite all these factors, there's been remarkable success in sort of tracking and containing the disease. That seems very hard to believe to me. It seems too good to be true, but it can't be excluded at this point. It's very possible that there's a lower infection fatality rate, like 0.1%, in Santa Clara County. And that would explain why things aren't as bad as you would think. And that's consistent with these antibody tests, but again, those are very preliminary. Important thing to keep in mind, for example, is there may be, well, we know for a fact there are other factors that contribute heavily to whether you die from this disease. Santa Clara County is very warm and sunny. It's almost like a balmy summer weather most of the time, all year round. If you look at the statistics for other causes of pneumonia and influenza, things like influenza viruses, for example, other coronaviruses, diseases that cause what people usually call the common cold or sometimes the flu, these diseases are highly seasonal. So you get many more deaths in the winter when it's cold and dark than in the summer. So it could be that Santa Clara County is a very good climate and you just don't get the level of deaths maybe you would see like in New York City where it's colder and darker. There clearly can be many other factors like pollution that further contribute, and perhaps ones we know nothing about that explain these wide variations, why you have, say, a deadly outbreak in New York City or Lombardy, Italy, and yet you don't see much here in Santa Clara County so far. There could be many unreported cases and deaths in Santa Clara County. Of course, their county has just reported 3 deaths that they had missed from presumably tests run during autopsies. There could be some other reason, something I haven't thought of or I don't know about. It could be a combination of some or all of the above. It's very hard to analyze multifactorial or multidimensional data. So if you have even 2 sort of independent factors that drive, say, the mortality, the likelihood you will die from the disease, and actually there's almost certainly more than 2. But if you even have 2, the results can be very confusing. You can say, well, we look in New York and we see one thing, and we look in Santa Clara County and we see something totally different. And then people get into endless arguments because actually the evidence in Santa Clara County supports one factor and the evidence in New York City supports another factor. They're two factors. Now, we already can say that age and particularly pre-existing medical conditions in some way make a very big difference. That's not unusual with diseases that cause pneumonia and influenza. But presumably there are other factors we have not identified, which can include pollution, they can include sunlight levels, they can include temperature, humidity, and perhaps things we've never thought of. So in conclusion, the COVID-19 coronavirus cases, and especially the death figures in Santa Clara County, with only 94 people dead from the disease in a county with very large population and very close intimate ties to China, seem too low. I mean, they are quite remarkable. This video was produced on April 23rd, 2020. I will include my standard professional disclaimer that I'm not a medical doctor, I'm not a licensed professional of any type, and if you need medical advice or health advice or legal advice or financial advice, you should seek out such a professional, particularly with medicine, seek out a medical doctor and so forth, and get professional advice. This information is provided for educational, informational purposes only. It is at best a starting point. It is preliminary. The situation is changing very rapidly. So there's a lot of confusing information being put out by both government agencies, things like the CDC, and various people publicly. So investigate carefully, and make up your own mind. This concludes this video presentation. If you like this video, please click like. Please click subscribe and the notification bell if you would like to receive more content from us. You can avoid internet censorship by subscribing directly to our RSS news feed. Please consider sharing the link by email or on your website or blog, in addition to liking, upvoting, or sharing on increasingly censored, advertising beholden, and big company social media. We have encountered such censorship. Mathematical software is developing software to automate data analysis, reducing the risks of costly errors and improving results. You can support our work financially by subscribing on our Patreon page. Scan the QR code in the lower right corner to get the Patreon link. Our Patreon link is also in the show notes below.